my name is Jonathan Rich and I'm a surgeon with the group Statewide Bariatrics, and today I'm going to be discussing the gastric sleeve procedure in this video, which is illustrated to the side of me. The gastric sleeve is one of the most exciting areas of weight loss surgery right now. We're seeing some excellent results with minimal change to the body, and I'm going to clear this up and make everybody understand this very well throughout the course of the video. So to begin with, the main concept of the sleeve procedure, first of all, does not mean that we're putting a sleeve in or around the stomach. That's a common misconception. The term sleeve refers to a reshaping, the same way a tailor reshapes a sleeve of a shirt to be an arm size. This case, we're reshaping the stomach to be the same size as the rest of the intestine. So if you look at the diagram here, the intestine right above the stomach and the intestine right after the stomach are tubular structures. They're typically about the size of a banana with the peel on it. The stomach is a large area where the body balloons out to hold more capacity. This used to be a survival advantage when food was scarce, but now that food is readily available, it's actually a detriment. And this is one of the underlying reasons why people can store more food and feel hungry and gain weight. The idea behind the surgery itself involves removing the outer part of the stomach to reshape the stomach size, and we are also changing the appetite level, which I'll get into in 1 minute. So the obvious part, if we remove the outer part of the stomach, the size of the stomach changes, and therefore the capacity of what somebody can eat changes. Before the surgery, people eat normal portion sizes that they've always eaten their entire lives. Following the surgery, a small portion will fill someone up. When we do the procedure, the resected part of the stomach, the part that's removed, is about 65 to 70% of the total stomach size. So we're keeping 30 to 35% of the stomach intact. And the way that we determine that reliably is we use measuring tubes. So when we're doing the procedure, at the beginning of the case, as soon as someone goes to sleep, a measuring tube is placed into the stomach, and the measuring tube tells us exactly how big to make the stomach. So we're never guessing when we're in doing a surgery. These are very calculated procedures. When we get in to do the outer resection of that outer part of the stomach, the measuring tube, once it's in place, becomes our guide. We then use surgical stapling devices to come right along the side of the measuring tube, and the outer part of the stomach is removed. The secret on how we're able to get the outer part of the stomach out through small incisions is the stomach is hollow. So when we're doing these surgeries, the stomach that's removed does not require a large incision to take it out, because the stomach itself is like an empty balloon once it's divided. Once the stomach is divided, this outer part's removed. We do all of our surgeries laparoscopically. So the incision size for the procedure, the largest scar is about 1 inch, and the remaining scars are about 1 centimeter each. We typically use about 4 incisions to complete the procedure. So there's about 4 little scar areas on the abdominal wall following the surgery. When we remove that outer stomach, a couple of really neat things happened. The first is quite obvious. We're taking the stomach out, and therefore we're reducing the size. So logically, a smaller portion will fill us up. Following the procedure, the stomach size becomes approximately the size of 2 eggs. So that small portion makes somebody satisfied and feels full. The second part on how this is working is probably more important than just a small portion size. We now know hunger is very closely tied to hormones, and the hormones are actually secreted by the cells of the stomach. So when we have the stomach intact normally and somebody feels hungry, it's typically because the food has left the stomach and traveled further down, and the stomach is trying to get somebody to go find more food. To do that, the cells turn to the bloodstream and release a surge of appetite hormone. This is what makes somebody hungry, this is what stress eating is related to, and this is what cravings are related to. That hormone is named ghrelin, G-H-R-E-L-I-N. And that's one of the main causes of why people feel hunger. When we're doing this procedure, by removing the outer 65 to 70% of the stomach, we're also reducing that hunger hormone by approximately the same amount. So following the surgery, once this extra stomach is taken out, a small portion fills the person up because this area fills up quickly with food. They're able to put the fork down and feel full, and then they're not hungry, typically for 5 to 6 hours after they eat that small meal. This is how the whole procedure is working. To put this all together, the example I like to use is just a simple 3-egg omelet. If someone's a month after surgery, goes to a diner, orders a 3-egg omelet for breakfast, they won't be able to finish it. You will finish about 2 eggs worth of the omelet, feel like you're full, and put the fork down. That's phase 1 of how this works. The second part relies on that appetite hormone. And because the person is not as hungry anymore, that small portion makes them satisfied for a long amount of time. When they do eat again, it will be a much smaller portion than normally, and this is what's doing it. Small portions consistently over time are generating the excellent weight loss. The best part about this surgery really is that we're not changing the body. Aside from removing that outer part, the function remains the same. So our function following this procedure in the stomach that remains is identical to how it was beforehand. The acid level is the same, therefore the digestion is the same, but most importantly with this surgery over the gastric bypass is your food flow is the same. So when you eat, food goes on its normal path of digestion. Therefore, we're not seeing nutrition deficiencies with these procedures. To date, we've performed over 5,000 surgeries and we have nobody having significant nutritional issues. We do still recommend normal vitamin supplementation following the surgeries, and we do check lab work on a regular basis to make sure that everybody's in the right ranges, but this is not causing nutritional problems following the procedure, which is excellent. So that's the main summary on how the procedure works. Well, how's the recovery from it? Typically, the surgery is about 45 minutes. There's 4 small incisions that we use to do the procedure, and it's a 2-night stay in the hospital. We keep people 2 nights in the hospital only because they have no appetite for the first 24 hours. All of the patients following the procedure are up, walking around, feeling quite well and moving okay, but they have no desire to eat or drink anything following the surgery for about 24 hours. That's the entire reason we keep our patients 2 nights in the hospital. That first 24 hours, the stomach is settling down. The second 24 hours, we make sure everyone's tolerating their diets well before they leave the hospital. On day number 2 is discharge following the surgery, and we advise patients to take approximately 1 to 2 weeks off of work. The only main restriction following the surgical procedures is no heavy lifting for approximately 3 to 4 weeks' time. When I say heavy, I mean heavy. We're talking more than 40 pounds. Light objects, my rule of thumb is anything you can lift with one arm is typically fine to lift. We just don't want someone heave-hoing a very large heavy object. That can be a hernia risk. But otherwise, the recovery from this is very well and goes as expected. I look forward to meeting you soon. Thank you for listening to the video, and happy to answer any questions in the upcoming meeting. Thank you.